I'll just take questions. How's that?
Suspend the rules?
There is no agreement at this time to suspend the rules or on a bonding bill. So at this point, we're not planning to vote to suspend the rules. Our members have made reasonable requests, and we think it's reasonable that we just get to read the bills. We get to understand the bills and comprehend what's in them. I'll remind folks the HHS bill doesn't exist yet. It hasn't been written yet, and it would be very difficult for us to say we're going to take up and pass bills in a 24-hour period that we haven't even seen yet. When that bill went out of the House, it was the largest bill ever passed by the legislature at 1,100 and some odd pages. I think it's reasonable for our members to say that we'd like to be able to read the bills and comprehend them, and that we think the public should also read them. I was pretty clear earlier in the week when I said I'd like to see a change of course where we actually have a transparent process where the public can have some input and can read and see and comprehend what's in these bills. So we're still asking for that.
You're prepared to keep everybody here Friday, Saturday, Sunday, maybe Monday?
Well, it's not us. I didn't call the special session.
But you're prepared to allow that to happen?
Well, we came to do our work.
In terms, could you explain what suspending the rules means and why it's necessary?
Well, actually what would happen is you need to suspend the Constitution, because our Constitution says that a bill gets its first, second, and third reading each on a separate day. So I know the Speaker talked about her constitutional duty, and the first thing she wants us to do is suspend our Constitution to take up bills that we haven't seen and haven't read, that don't exist yet.
Can I add to that?
That's a kind of a tough thing. So, when we're doing things that are easy to comprehend and that there's some urgency that they need to happen, I met with the governor, or we met with the governor yesterday morning. I met with him the night before, one-on-one. I gave him very strong advice that what we need to do here is just take a breath. Let's let everybody go home for the holiday weekend. We'll come back next week. Let's let these bills get introduced, and let's let them marinate. Let's let the public be able to absorb what's in them. We'll come back next week. We can do some hearings at the beginning of the week, and we can pass the bills out probably in one day. That would be reasonable, and we would support a reasonable approach. But for some reason, the governor and the two majority leaders decided that it was time to call a special session on a Friday without agreement, and it's very unprecedented that there's no agreement from the minority leaders. We don't know of a time that that's ever happened before. So we're certainly open. We're all ears today if they want to talk about, moving this along quicker, but at this point, they didn't listen to us at all during the process. We were completely cut out of creating the bills. My caucus had no idea and still has no idea what's in a lot of these bills. The HHS bill hasn't even been written yet. So it's difficult for anyone to even ask. In the meeting with the governor yesterday, I said, I hope nobody even asks us to suspend the rules, because I don't think that's fair. This has been the worst process that I have ever seen in my time here, and from people who've been here a lot longer, they agree that this is the worst they've ever seen.
What is the minority required to allow this process to move along, as you say?
The process will work just like it has for 150 years in the state of Minnesota. We'll take up the bills, and they'll get introduced today. They'll get referred to committee. We'll go to committees, and we'll have hearings on the bills, and the public can give input.
There's nothing that you can talk about. You said you're talking to the Democrats and the governor about how to move the process forward. What is that? How do you move it forward?
Well, I think we want a transparent process. We want the public and we want our members to be able to see and know what's in these bills. I think at a minimum probably 3 days. We'll see what happens, but...
With the exception of HHS, though, all these bills, there have been public meetings. We've been watching them on TV. We actually know quite a bit for this stage of the last minute whatever, with the exception of HHS. Can you dispense with all the bills except HHS and vote those through?
No, we're just asking for what we think is reasonable. We want to be able to read the bills.
Provider tax that we don't.
The tax bill is a net general fund tax increase on Minnesotans. In addition to that, it houses the provider tax, which is a huge tax increase and raises the cost of health care for everyone. I don't suspect that the tax bill will get a single Republican vote.
You mentioned another point that the minority leaders were not part of this negotiations. How big a role does that fact play in the stance you're taking on not suspending the rules?
We just, how could I suspend the rules for things I haven't even seen yet? This process has been really bad. I know that all of you felt like you were cut out of the process as well. You were. You should feel bad. But imagine how my members feel. No one was briefing us on what was in the bills. Nobody even came to us with a courtesy and said, you know, there's 3 people in a room making some decisions about what's going to be in these bills. Are there any non-controversial things that are really important to your members that we maybe should include? Nobody had those conversations. I got to tell you, I'm kind of shocked as a legislative leader in this state that nobody came to us and said, you know, are there some little non-controversial things that are really important to your caucus that should be included in these bills? And those things just simply didn't happen. Thank you.